When most people think about smoking, they imagine the damage it does to the lungs or the heart. But for someone living with an autoimmune condition like Sjogren syndrome, every cigarette carries a hidden double danger. It's not just smoke filling the lungs. It's a chain reaction that weakens the immune system, accelerates inflammation, and worsens the very symptoms that make daily life with Sjogren's so challenging. Imagine dealing with dry eyes, dry mouth, constant fatigue, and then adding smoke that irritates, inflames, and exhausts your body even more. That's the reality for many people who struggle with both smoking and this disease. The connection is rarely talked about, yet it's powerful, and understanding it could change the way you see both smoking and autoimmune health. In this video, we'll uncover exactly why smoking is such a dangerous trigger for Sjogren's, how it accelerates complications, and most importantly, what steps you can take to protect your health and future. 1. Sjogren's syndrome and smoking, the hidden double risk for your health. Sjogren's syndrome is one of those conditions that often hides in plain sight. It's an autoimmune disorder, which means the immune system, instead of protecting the body, mistakenly turns against it. In the case of Sjogren's, the immune system mainly attacks the glands that produce moisture. That's why two of the most common symptoms are dry eyes and dry mouth. At first, these might sound like small inconveniences, but for people living with the condition, they can be daily struggles that affect comfort, energy, and even long-term health. Dry eyes can lead to burning sensations, blurred vision, or infections, while a dry mouth can make eating, swallowing, and even speaking more difficult. It also increases the risk of cavities, gum disease, and digestive problems. But Sjogren's doesn't stop there. Because it's a systemic autoimmune disease, it can reach far beyond the mouth and eyes. Many patients deal with joint pain, chronic fatigue, and a general feeling that their body is constantly inflamed. In some cases, it affects organs like the lungs, liver, and kidneys. This is what makes Sjogren's so complex. It isn't just about dryness. It's about an immune system that is confused, overactive, and constantly attacking its own tissues. What's more, Sjogren's tends to affect women over 40 and 50 more often, a stage of life where the immune system is already changing, and the risks for other conditions such as high blood pressure or heart disease are increasing. This overlap makes managing Sjogren's particularly challenging. People don't just deal with one issue, but with a web of interconnected health concerns. Even though researchers continue to study the disease, there is still no cure. Management focuses on easing symptoms and protecting the body from long-term damage. That might include eye drops, saliva substitutes, anti-inflammatory medicines, or lifestyle adjustments like staying hydrated, protecting the eyes, and maintaining good oral health. Understanding the foundation of Sjogren's is important because it helps us see why adding smoking to the picture is so dangerous. A body that is already struggling with immune dysfunction, dryness, and inflammation doesn't need another force working against it. And yet, smoking introduces exactly that. A storm of toxins and irritants that push the body even further away from balance. 2. Smoking destroys lungs, heart, and immune defense. Smoking is often described as one of the most harmful habits for the human body, and science has made it clear why. Every time a cigarette is inhaled, thousands of chemicals enter the lungs. Among them are tar, carbon monoxide, and nicotine, each with destructive effects. The lungs, designed to bring oxygen into the bloodstream, become coated with irritants that scar delicate tissues and reduce breathing capacity. Over time, this constant irritation weakens the lungs, leading to conditions like chronic bronchitis, emphysema, and eventually chronic obstructive pulmonary disease. For someone already dealing with a fragile immune system, this extra damage makes daily life far more difficult. But the harm doesn't stop at the lungs. Smoking also damages circulation. Carbon monoxide competes with oxygen in the blood, making it harder for cells and organs to get the fuel they need. Nicotine constricts blood vessels, raising blood pressure and putting more strain on the heart. This increases the likelihood of heart disease and stroke, both of which are already higher among people with autoimmune conditions. Instead of nourishing the body, smoking slowly starves it of oxygen and places it in a state of constant stress. Another critical piece is the immune system itself. Cigarette smoke doesn't just irritate, it suppresses the body's defense mechanisms. White blood cells, the very soldiers meant to fight infection, become less effective. Inflammation markers rise, making the immune system more chaotic and less able to distinguish between real threats and the body's own tissues. This is particularly dangerous for autoimmune disorders, where balance is already disrupted. Scientific studies repeatedly confirm these dangers. Smokers are more vulnerable to infections like pneumonia and flu. Their wounds take longer to heal, and their risk of developing cancers, including lung and throat cancer, is far higher. For older adults, especially those managing chronic illness, smoking becomes a trigger that accelerates decline across multiple systems at once. Understanding this baseline of damage is essential, because when we connect it back to Sjogren syndrome, the risks multiply. A body weakened by smoking is not just unhealthy, it is far less equipped to handle the dryness, inflammation, and immune dysfunction that come with this condition. 3. Smoking makes Sjogren's symptoms worse. When we look specifically at Sjogren syndrome, smoking acts like fuel poured onto an already burning fire. The hallmark of this disease is dryness, dry eyes, dry mouth, and often dryness throughout the body. Cigarette smoke intensifies that dryness. It irritates the delicate membranes of the eyes, making them more red, gritty, and prone to infection. For the mouth, smoking reduces saliva production even further, leaving the mouth painfully dry, uncomfortable, and more vulnerable to cavities, gum disease, and oral infections. What is already difficult for someone with Sjogren's becomes far more severe under the effect of smoking. The immune system is another point of attack. In Sjogren's, the immune system is already overactive and confused, targeting the body's own tissues. Smoking worsens this imbalance. Chemicals in cigarette smoke increase inflammation, push immune cells into a hyperactive state, and reduce the body's ability to calm that response. The result is more pain in the joints, more fatigue, and a faster progression of symptoms. Instead of controlling the disease, smoking magnifies its reach. Inflammation is at the center of both smoking damage and autoimmune activity. With Sjogren's, chronic inflammation affects glands and organs. With smoking, toxins spread that inflammation through the lungs, blood vessels, and immune pathways. Together, they create a cycle of irritation and destruction that makes recovery harder and complications more likely. Even beyond the dryness and inflammation, smoking affects the skin, blood vessels, and nerves, which are often already impacted by Sjogren's. Patients may notice more frequent infections, slower healing, and more severe complications when smoking continues. In short, smoking does not just add another health risk. It directly worsens the very core of Sjogren syndrome, making everyday life heavier and long-term outcomes more dangerous. 4. The double risk on heart, lungs, and faster complications. When someone lives with Sjogren syndrome, their body is already working under unusual stress. The immune system is misdirected. Glands that should keep the eyes, mouth, and airways moist are under attack, and inflammation quietly spreads through tissues and organs. Now, imagine layering cigarette smoke onto that fragile system. Instead of just one enemy, the body is suddenly fighting a double war. This is what makes smoking with Sjogren's Such a dangerous combination. It doesn't just increase risk a little, it magnifies it, making complications appear sooner, strike harder, and leave lasting scars. The first place where this double risk is most visible is in the heart and circulatory system. Chronic inflammation caused by Sjogren's already raises the risk of heart disease. Blood vessels become stiffer, the lining of arteries less flexible, and circulation less efficient. Smoking adds another layer of damage. The nicotine in cigarettes narrows blood vessels, forcing the heart to work harder. Carbon monoxide in smoke replaces oxygen in the bloodstream, starving cells of the fuel they need. Over time, this leads to high blood pressure, thickened artery walls, and dangerous plaque buildup. For people without autoimmune conditions, this is already life-threatening. For someone with Sjogren's, it is a direct pathway to heart attack or stroke much earlier in life than expected. The lungs tell a similar story. Sjogren's can cause airway dryness and inflammation, making breathing less comfortable and increasing susceptibility to infection. Cigarette smoke attacks the lungs in multiple ways. Tar builds up inside delicate air sacs, reducing their ability to transfer oxygen. The toxic particles scar tissue, causing permanent damage that can lead to chronic bronchitis or emphysema. Lung cancer risk rises with every puff, and when the lungs are already vulnerable due to autoimmune activity, the likelihood of serious respiratory disease is far greater. Even a mild cough can evolve into a chronic struggle for breath, leaving patients exhausted and fearful of every infection that comes their way. Infections themselves form another layer of risk. Sjogren's impairs the immune system, leaving patients more vulnerable to viruses and bacteria. Smoking further suppresses white blood cell activity, the very defense mechanism the body needs. The result is a person who catches infections more often, struggles to recover, and faces repeated flare-ups of their autoimmune condition. A simple cold can turn into pneumonia, and a small infection can take weeks to heal, draining energy and worsening overall health. These frequent illnesses add up, creating a cycle of sickness and fatigue that shortens the body's resilience year by year. But perhaps the most underestimated effect of this combination is the pace at which the disease progresses. Autoimmune conditions like Sjogren's often move slowly, allowing people to adapt and manage symptoms over time. Smoking changes that timeline. By increasing inflammation, reducing oxygen supply, and damaging organs at a faster rate, it accelerates decline. Patients who smoke are more likely to see complications earlier, experience organ involvement sooner, and face a reduced quality of life far more quickly than non-smokers with the same condition. What could have been managed for decades with lifestyle adjustments and medical care becomes a steep slope of decline. Beyond the physical risks, there are emotional consequences as well. Living with Sjogren's already means coping with fatigue, dryness, and pain on a daily basis. Adding smoking into the picture often brings feelings of guilt, frustration, and helplessness, especially as symptoms worsen. Many patients feel trapped, knowing cigarettes are harming them, but struggling to break free of addiction. This emotional stress feeds back into the body, raising cortisol levels, further disrupting immune balance and deepening the impact of both smoking and disease. When all of these factors are put together, the idea of a double risk becomes undeniable. The heart is more fragile, the lungs more damaged, the immune system more unstable, and the pace of disease faster. Each cigarette makes the gap between health and illness wider, and the climb back to stability harder. Doctors often warn patients with Sjogren's that smoking is not just an additional risk factor, as it might be for the general population. It is a direct accelerator of the disease itself, magnifying every complication and bringing them forward in time. Understanding this reality can be painful, but it is also empowering. It shows why quitting smoking is not just a general health recommendation. It is one of the most important choices someone with Sjogren's can make. By removing the second enemy from the battlefield, patients give their bodies a chance to stabilize, to slow down the progression of complications, and to regain some control over their health and future. 5. Steps to protect health and break free from smoking. Hearing about the dangers of smoking, especially when living with Sjogren's syndrome, can feel overwhelming. The risks are real and serious, but this story does not end with damage and decline. There is always room for change, and science has shown that the body can begin healing the moment cigarettes are left behind. What feels like a lifetime habit can be broken, and with each step away from smoking, the risks shrink while energy and health slowly return. For people with Sjogren's, this is not just a choice about quitting a bad habit. It is a decision to slow the progression of disease, reduce complications, and give the immune system a chance to find balance again. The first strategy begins with awareness. Understanding the double risk of smoking and Sjogren's is the foundation for change. Many people continue smoking because the damage feels distant, something that might happen in the future. But for someone with an autoimmune disorder, the harm is immediate. Each cigarette dries the eyes and mouth further, suppresses immune function, and increases inflammation within hours. Recognizing this direct and daily connection makes the urgency clearer and can provide motivation to begin. Support is the next key. Quitting smoking is rarely a journey that succeeds in isolation. Family, friends, and healthcare professionals form the network that makes change sustainable. Speaking openly with a doctor about the desire to quit allows access to tools like nicotine replacement therapy, prescription medications, or counseling programs. These supports do not replace willpower, but they strengthen it, making each attempt more likely to succeed. For someone with Sjogren's, involving healthcare providers also ensures that the approach to quitting considers other medications, symptoms, and overall health needs. Lifestyle changes play a central role as well. Smoking often fills gaps of stress, fatigue, or habit. Replacing cigarettes with healthier routines can help reduce cravings and create a sense of progress. Simple practices like drinking water to ease dryness, chewing sugar-free gum to stimulate saliva, or sipping soothing herbal teas can take the place of reaching for a cigarette. Physical activity, even gentle walking, improves circulation, reduces stress, and lifts mood, all of which help fight the urge to smoke. For people with Sjogren's, exercise also supports joint flexibility and overall energy, creating benefits that reach beyond quitting itself. Another powerful tool is mindfulness. Many smokers find themselves lighting up without even thinking, driven by stress or routine. Techniques such as deep breathing, meditation, or even pausing to stretch can interrupt that automatic response. Each time a craving is managed without smoking, confidence grows. Over weeks and months, these small victories add up, turning the struggle into a story of resilience and control. Nutrition also plays a role. A balanced diet rich in anti-inflammatory foods supports the immune system and helps the body recover from years of smoke exposure. Omega-3 fatty acids from fish, antioxidants from berries, and fiber from vegetables all help reduce inflammation and improve cardiovascular health. Staying hydrated is especially important for Sjogren's patients, as it counters dryness and supports digestion. By combining quitting smoking with nourishing the body, recovery feels more complete and motivating. It is also important to acknowledge setbacks. Many people attempt to quit multiple times before success. This is not failure, but part of the process. Each attempt teaches something new about triggers, strengths, and strategies that work. For someone with Sjogren's, every day without smoking is progress toward reducing complications, even if the journey is not perfectly smooth. The key is persistence and the willingness to try again, knowing that the benefits outweigh the struggle. Finally, focusing on the vision of a healthier future can provide ongoing strength. Imagine breathing more freely, feeling less fatigued, having fewer infections, and giving the heart and lungs a chance to heal. For those with Sjogren's, quitting smoking means not only fewer flare-ups, but also more stability, more control, and more hope. The body begins to repair itself within hours of the last cigarette. Blood pressure improves, oxygen levels rise, and inflammation starts to settle. Over months and years, the risk of heart disease, stroke, and cancer steadily drops. Quitting smoking is one of the most powerful steps any person can take, and for someone with Sjogren's syndrome, it is life-changing. It means breaking the cycle of double risk, reclaiming energy, and slowing the disease's progression. It is not easy, but it is possible, and countless people have already proven it can be done. With awareness, support, and consistent action, each person has the power to choose health over harm and write a new story of resilience, healing, and strength. Smoking on its own is harmful, but for someone living with Sjogren's syndrome, it becomes a double burden. It worsens dryness, weakens the immune system, and speeds up complications that already make life challenging. Yet the story does not have to end there. Every choice to put down a cigarette is a choice to protect your eyes, your mouth, your lungs, your heart, and your future. Progress may feel slow, but each small step adds up to a stronger, healthier tomorrow. If this video has given you a clearer understanding of the risks and the hope for change, take a moment to share your thoughts in the comments. Your story might inspire someone else on the same path. And if you want more science-backed health tips designed for people over 50, don't forget to like this video and subscribe to Active Healthcare. Together, we can make the journey to better health more informed, more supported, and more achievable.